You're watching CBS 2 News in high definition.
New hope for women to rebuild their appearance after mastectomy.
CBS 2's Dr. Holly Phillips joins us now with more on that. This is a big, big development.
It really, really is. It's still preliminary, but it's so it's inspiring right now. Well, every year, nearly 200,000 American women are diagnosed with breast cancer. For them, one of the most difficult challenges is losing a breast and then possibly going through reconstructive surgery. Now, some preliminary research may one day allow the body to regrow healthy tissue itself. Scientists are about to begin trials that they hope one day will help breast cancer victims regrow their breasts after a mastectomy. The trials, to begin in the next 6 months, involve implanting a device that helps fat cells regenerate using stem cells.
What it entails is a chamber or a shell that they're putting in women after they've had mastectomy, and the chamber is filled with a woman's own fat cells, and they believe these fat cells can be able to grow.
Researchers hope the procedure, known as NeoPEC, could one day replace reconstructive surgery and breast implants. Right now, there are more than 2.5 million breast cancer survivors in the United States, and most of them have undergone some form of breast surgery. So improving options for reconstruction could make a huge impact.
Following a mastectomy, the loss of a breast has tremendous impact on a woman.
So far, the technique has only been tested in animals who grew new breasts within 6 weeks. Experts predict the process could take up to 8 months in women, but the experiments are very preliminary.
We don't know yet what the potential complications will be, what the results will be, issues such as patient satisfaction.
Dr. Alyssa Gillego is a breast cancer surgeon. She says breast reconstruction is an important part of the healing process.
Studies have shown that when a woman does have reconstruction after mastectomy, that in the long run it's much better for their sense of well-being, their psychological wellness.
And hopefully one day this technique will provide breast cancer survivors with even more options for a full recovery. The researchers say their technique may one day be used to regrow more than just breast tissue. They hope the approach, if it's successful, could also be used for rebuilding other parts of the body affected by illness. And so far, there are 6 women scheduled to begin the treatment early next year.
Dr. Phillips, can you just quickly review the options that are available now for reconstructive surgery?
Sure. Well, right now, by far the majority are still implants, saline or silicone. Sometimes people will use tissue expanders to actually make room for those implants. Something growing in popularity is also called an autologous tissue transplant, where they take tissue from another part of the body and move it up to the breast area. But of course, something like this, where you could actually regrow the cells themselves, would really take this research to another level.
Quite something. Dr. Holly Phillips, thank you.